Marilyn, thanks for taking time to share your story with us.
My pleasure.
So tell me a little bit about your background. You've worked in the medical field?
Yes, I moved to Arizona when I was 13 years old, and at 14 I started working as a candy striper at a hospital, and from there at 16 I became a nursing assistant. When I graduated high school, I went into nursing school, and after my first year of nursing school, I took my LPN board so that I could work the next 2 years as an LPN instead of an aide, and married during that time, and then I graduated from Good Samaritan Hospital School of Nursing as a registered nurse, and have worked in my field, or in the nursing field, for close to 50 years.
Wow. So you then became a patient recently and had some cell therapy. So tell me what caused you to go do that.
I did. From being a nurse, I ended up with bad knees and hips from just being on cement floors all those years. And a little over a year ago, I had a total knee replacement on my left knee, and I've done very well with it. But my right knee was bad, and I started thinking, could I try some other alternative? When I had the knee surgery, there was no alternative. I was falling. It was that bad. It was not stable. So I started researching stem cells. Came in, and I had my right knee done first, and did really well with that. And then I had both my hips done, and I've done well with that. Not as good as my knee, but well.
So let me ask you about this. So when you had your right knee done, you're talking about you had it injected
Yes.
with cell therapy. How long was it before you started feeling results?
Actually, well, because of using, the next day it was better even. And then by about a month, I mean, it was really where I could do anything I wanted to do again, and no pain in that knee. I never stop exercising, ever. I work out 4 days a week still, but it was much easier after the stem cells.
And was there an assessment on it? I mean, how was your knee degenerated before?
I was bone on bone.
You were bone on bone?
I was bone on bone in both knees.
And they would have said that this is a surgical case?
Yes, they were ready to say, well, when you recover from your left knee, we'll do your right knee. And I really, as well as I did after the left knee, I wanted to try an alternative first.
Even though the surgery went well for you, it's a tough road, I imagine.
It's a very tough road. The rehab is the hardest part. The surgery you're asleep for, you don't really have any problems with that. The rehab is very difficult, and since most people have total knees when they're older, it makes rehab that much harder.
Right. And then you said, what kind of problems were you having in your hips?
Just arthritis.
Yeah.
I have arthritis in my hips just because.
Was it just aching or?
Pain, sometimes little catching, but it's much better. It's not gone, but it's better.
And how long ago did you have the hips done?
December.
So that would have been just a couple months ago. And is there a possibility that there's still time for them to continue to improve?
Oh, I think so.
Yeah.
They say 6 months to continue. And then I had my knee done in October. So they were about a month apart.
And is your knee still getting better at this point, do you notice? Or you
I think so. I mean, I'm such an active person that I don't give in to things easily.
Yeah.
So I walk 3 to 3.5 miles 3 days a week. Then I go to the gym and I do a class, and then I do a cardio gym class on a floor, and I don't have any pain in that knee during any of those things, and I did before.
What were your expectations? So did you think you'd get like a little relief, a lot of relief? It would get back to where there's no pain.
I was hoping for a lot of relief. I'm not so naive to think that anything's going to give you 100%, especially when you're older. You put a lot of wear and tear on your joints.
Yeah.
But I was hoping for a lot of relief.
And at this point, do you feel like that's what you received?
I do.
Yeah.
I do. I'm much more functional, much more comfortable doing what I want to do.
And certainly, without going through surgery.
Absolutely.
Yeah. So anything else that you would share about this that you think people would want to know?
And I know it's not covered by insurance, and I know it's very expensive for most people. I still think it's a great option to try before you go through a major surgery. If it doesn't work for you, and I know it doesn't work for everyone, but I still think it's a great alternative to try for that first. Because if it doesn't work, most all of us have insurance, and you're not going to be paying that much more to have the knee surgery or hip surgery or whatever you have to do afterwards. But I think if you get as good results as I do at my age, you may never need the surgery And I think that's a real positive thing for people, especially being in the medical field. I can say that with all honesty, that nobody should go through surgery unless it's absolutely necessary.
Yeah, it's a pretty tough road when you start going down
Well,
that road.
there's a lot of risks with surgery too,
Yeah.
and it's not just the surgery itself. You're dealing with anesthesia, you're dealing with a lot of therapy. I mean, you're dealing with a lot of things when you go through a major surgery of rehabilitation.
For sure. Well, thank you very much, Marilyn, for taking the time and sharing your story.
It's been my pleasure, and I hope that I help you all to have more people come and to get, hopefully, insurance to someday cover this for people.
Yeah, it would make a lot of sense, wouldn't it?
Well, to me, it makes like 100% sense because I think they'd spend a whole lot less money in the long run, but not my job.
Yeah, exactly. Thank you very much.
My pleasure.
My name's Michael. My doctor wanted me to give you guys an update from the stem cell therapy I had some months ago. Just so you know, I've been on pain medication since the year 2002, and it just kept getting worse and worse. The pain just kept getting worse and worse. So I researched stem cell therapy, tried it a few months ago. I'm no longer on pain medication. I'm able to go back to work full time. I feel real good about myself. Now, I'm not saying that stem cell therapy is for everybody. I don't know that much about it, but I'm 65 and I'm doing things that I couldn't do years ago. But I know after what all I went through, I'm feeling pretty doggone good, and I'm hoping to get better.